information course to make sure that we only get the available resources for the psychologists. So it's managed by psychologists in that case to make sure that they respond to all that. So the call center has been the key or the center stage for the step care model by making sure that where we see the website down there and the other information, we generate sufficient information from the call center to make sure that we respond to what the young people are looking for. The other key thing is the peer indicators that we see in the step care model. We get the training needs from this call center to make sure that we respond to the peers, the counselors themselves, the peer indicators of the key components. The main thing that was to integrate the chatbot, the AI component of the chatbot, the SMS, the call, and to mean the platforms to one single user by the counselors. So as a young person, whether you text outside the chatbot, you text to the call center, you text through our WhatsApp. So in the single platform, the counselors get in one user interface. So when they respond, it responds based on the platforms. So based on this one, we made sure that we don't have a fragmented internal systems to help the counselors to respond to all this in this step care model. Next. So this is what I've summarized based on that step care model that we saw, because all the resources, and you saw the higher you go, the more costly it become. So it becomes quite a little bit costly here at this level, because you pay the cost of the psychologist, the core of the core itself. Mark you, the users don't pay. So it's free from the user perspective, but from the call center itself, you have to pay all these kind of the components. So when we're building all the entire ecosystem, we looked at all those components. And one of the biggest strengths from all this is there is quick and effective referral to health facilities. And you can be able to track that. When you're using a smartphone or a feature phone, we have an address hub that links you from where you are. So we don't access your location where you are, but we enable for you to share your location and for us to give you a nearby facility that you can be able to do. So what we have been doing all this under the one-to-one, but next line, but the key question was, are we still from other digital solutions within the country? So the noise that Hand is talking about, you can have a very good platform. You can have a very good platforms, but speak to a very specific population. But you have other digital partners within the country, but also having almost the similar solutions. So we ask ourselves this question with other partners. Some of them are here, and I'm happy to see them. How do we respond to this fragment? How do we respond to these interoperability issues? How do we respond to the voices they are listening to? I'm waiting for the next slide. Yeah, so these are the things that I was talking about. So when you look at the data, the one will partner their own data, all those kind of the data being in different component. And the biggest component is also the infrastructure and disparities, the key component. You'll find you are using different tech, another pattern is different tech. So when you want to consolidate all the data together to inform the national systems, it becomes a challenge. So all these are the key, in as much as we do it from a singular brand, and then we have other partners together. So we ask ourselves these questions about the fragmentation, and we came with a solution. Next slide, for the digital health in Kenya. So to make sure that we address the element of young people fragmentation, the element of collaborative approach, what we are talking about, bring different partners together. We are more than 14 leading digital organization within the country that we are building one singular landing page for the young people that also takes you, the young person, to different solutions. If I am for information, another partner provides SRH services, so the partner can be able to be rerouted through also the help of the AI navigation within the landing page for that case. So for us, in this case, the step care model and all this is to make sure that there's awareness and access to the services, and making sure that those don't go to facilitate the young people, we can reduce those health disparities, and making sure that there is addressing the fragmentation at the long run. We know it may not be this year or next year, but it's a journey that we keep on going that. I would like to help and welcome my colleague, where the stepped care model is the newest. Miguel can be able to proceed.
Thank you, Robert. So it's a great pleasure also to share our experience of implementing the stepped care approach in Mozambique through the Vibrações website. Next slide, please. Okay. The Mozambican contest doesn't differ so much from what my friend Robert presented here about the fragmentation of digital SRHR services. And this situation does not help so much in terms of demand generation, especially because some of these digital tools or solutions are even not properly known by the young people. So it was in this contest that in 2022, in a collaboration involving the Coalizão Association, Catholic University of Mozambique, AIDSFONDS, SRHR, and the Maastricht University, we launched the Vibrações website. It was on Valentine's Day. But before that, we conducted several trainings and co-creation processes involving the Vibrações working teams and also the Mozambican young people. And finally, we tested our website among our target group to ensure that it responds their needs. So now we have about 118 content pages, 32,000 website users achieved in 1 year, and also for 158,000 people reached through our social media campaigns on Facebook. Next slide. So on the left side, you can see how the homepage looks like. We have 9 main topics with non-judgmental and sex-positive contents. And here, the right side is an example of how we're implementing the stepped care approach through Vibrações. For example, a young woman who is looking for contraception, she can go first to the website, which is the first step of the stepped care, and read information related to contraception and different methods. After that, she can decide to find an advice of what could be the best contraceptive for her. And now this could be done through a tool, automated tool that was developed in partnership with BWise. And after getting this advice, she can go back to the website to read more about that certain method suggested. Or in the second option, she can prefer to ask for an advice, a personalized advice from a health counselor through a SMS service called SMS Biz. It's operated under the U-Report platform, coordinated by the Associação V Coalizão. And the health counselor here, she can refer this young woman to health center to meet a health professional who are going to, in details, maybe give the contraception. But the health professional here could still refer this young woman again to the website to read more about the contraception, the different methods of contraception. The same works, for example, for safe abortion. We have contents on website, but also we through the Vibrações website, we direct the user to a DKT website about safe abortion. So they had more details of on how and where can you get these services. Next slide, please. So now we are working to have more collaborations, for example, with Movitel, is an internet provider, so that we can have a zero-rate website, the same as BWise. We are also developing, together with BWise, a clinic finder where the young people could find the service they need with all the locations from where they are. But also we are starting discussions with the Pathfinder so that we can develop content related to transgender sex workers, but also to discuss more on how can we help in the best way this group. And finally, we also in discussions with UNICEF so that we can integrate the U-Report Mozambique chatbot in a website, just also to extend the opportunities for young people to have more information. Next slide. So as you can see, we still have a lot to do, lot of opportunities for collaborations. We want to fill the area of mental health, key populations, and to have more tools, more tools on our website. So every collaboration is welcome. Viva Vibrações, thank you, muito obrigado.
I think one of the basic things about the stepped care approach is that you can be really, really proud of things that you did not develop yourself, because you are making use of successful tools that are already out there, that are proven, that are effective, and then not just link to them, but really integrate them, work with them, and make sure that they can be part of the health journey that you try to create. And I think this session, at least for me, is also proof of that, because I am very proud of this session, even though I did not create it myself. We had, well, obviously we had planned for more time for questions. And before we go to the questions, I just wanted to make sure that if you would like to know anything more about the stepped care approach, anything more about how it can improve self-care, how it can improve access to care, how it can improve sustainability, obviously you can ask me, but I really recommend that you find one of these three people and let them tell how it helped them, because I think that we are very much aware that we only see it from a bit from a distance, and they can really help you further. Something we would have done this by Menti, but I think we should now do it visually. Is that I have one question for you before you can ask questions of us. Is that maybe not necessarily after seeing these presentations, but by raising your hand, could you indicate whether or not you believe that there is a lot of power in collaboration when we want to improve digital SRHR for young people? Cool. Thank you. That's good to see. So now it's time for questions from you. Is there somebody who wants to ask a question? And then now you can raise your hand if you want to ask a question. I saw the gentleman in the back first with his hand up. How do we do this? Do I run there with a microphone, or I think I need to, huh? Because otherwise the people that are online cannot. Do a bit of walking around, also good for my health. And I'm going to be running back again.
Thank you. Thank you very much for this insightful presentation. I think the three presentations, Kenya, South Africa, and Mozambique, you show an important platform to get to reach to young persons. Very, very important. My concern, though, is something that I would maybe need to get insights and have the group discuss, is the issue of the digital divide. So you appreciate that there is a difference across our populations in terms of penetration, in terms of data, in terms of device access. And you'll find that there's also probably similar disproportion in terms of the incidence, the HIV, the SRHR problems. Those who have less access might actually have more problems. So as we develop these new initiatives, what are we doing? What's at the back of our minds in terms of also accessing those who have less accessibility to these new innovations, and what are we doing to reach out more to those? Thank you.
Okay, to just put it into one sentence, you have a concern that if we focus too much on digital, then how are we still helping the young people, but I think all people that have less access to digital solutions? Any one of you that want to comment on that? And I think you can use Robert.
Okay, I'll be able to pick that. There are two components we're talking about. The core component of access to the device, and there's a secondary to that, access to smart phone or internet-powered devices and the feature phone. When you look at the solutions that they are both having both of them almost accessing almost the similar information. So if you have a feature phone, you, like the SMS system, you can access the same messages that someone using the chatbot can be able to access. The only difference is you may not get the emojis, you may not get that kind of level of interacting, but the same model of the content. The second part is whereby you access digital solution from someone else. So there's an element of a parent giving a child or a young person to use their phone. So we are developing a solutions that ensures there's privacy, and there's an element of logging into that. I'm giving an example, like one of the products there for the menstrual health. Hockey does not correct personal identification data, but you can create a user account from someone else, then it log is off. So you're trying to look a scenario whereby you can use a community device, but you can log in with your own tools, but also giving access to both the feature phone and the internet enabled solutions to make sure that they have access to that. But also not forgetting the traditional approaches, the print media, having the magazine, having that content also distributable to that kind of the component. And finally, is making sure that the user does not incur the direct cost. The cost of calling to be free, the cost of SMSs to be free, the chatbot, they don't pay as long as you're connected to internet, although there's a debate of access, the cost of the internet itself, but where there's shared. So making sure that you minimize that divide as much as you can, and trying to figure out how else best from the users themselves to make sure that they can be able to access the solution.
Thank you. I think in the interest of time, if you want to hear like the reply from any of the other colleagues, that maybe we could do it after the session. You, ma'am.
Thank you very much for the presentation. I think it was really, really insightful. And for the fact that you actually cooperated with other people. So I'm a founder of Talk Pregnancy with Dr. Nuela, which is an organization which also promotes maternal, child, and adolescent health. And I use the social media as one of my powerful tools, because just in less than a year, I had over 1 million views. So I want to really find out how, in as much as the government accepts what you're doing, is there a way that they monitor what you're doing and to make sure that you're giving them the right information? And secondly, how do you actually evaluate your success? And this also goes in line with the question the other participant asked. If maybe like those who are far off in the community who don't have access to this, how do you evaluate maybe the success, even those who actually use it? How do you actually, for example, you can send someone to do a test. How do you evaluate they actually did the test? Thank you.
Thank you. So those are actually two questions. I believe the first question is working with governments and making sure that you give the information young people need, even if the government policy might be a bit restrictive. The second question is more about the evaluation of the impact that you have. Michelle, you want to go first?
I can take on the first question. So in terms of BWise in South Africa, I think I mentioned in the presentation that the Department of Health has been one of the key partners from the very beginning, so even with the revamp. And we found that it's not so much a case of monitoring as a case of we've put a system in place where, in terms of all the content that goes onto the BWise platform, it doesn't go there until we have actual experts from the Department of Health or from other organizations that we're working with to actually check that content. And as we're continuously updating, as policies change, as new products be introduced, for example, we're ensuring that government is there, the Department of Health is there every step of the way. So all of the content we have on BWise, on social media, on the website, IEC material, all of that content is actually reviewed extensively by experts before we share that content with young people and the broader population. And in terms of evaluation, I like putting people under the bus, so Robert or Miguel.
Thank you. For the Vibrações website, we have signed a memorandum of understanding with the Ministry for Health, and this has allowed us to have health professionals who check the contents that we develop and we publish it on the website. But also the Coalizão Association, who is one of the implementers of the Vibrações, participate in a multi-sectorial committee where the Minister for Health, Secretariat of Youth, and other stakeholders also participate to report the ongoing implementation of the initiative, but also to receive some guidelines. Yeah, thank you.
Thank you. Yes, I want to pick the impact, the evaluation, the question. So there are different levels that you can want to pick into. And I'm picking, like, for instance, the first one is, let's talk about access to information.